What I'm about to show you is going to make you question everything you've been told about lowering blood pressure with food. And when I reveal food number 1, the most powerful one that works faster than some medications, you're going to understand why thousands of seniors are reversing their hypertension without adding a single pill to their regimen. I'm Dr. Sandra Whitmore, and I need to tell you something that might change your life today. That blood pressure medication you're taking, there's a 60% chance you could reduce the dose or eliminate it entirely just by adding 8 specific foods to your diet. Not slightly reduce it, dramatically reduce it. And here's what excites me most. Right now, somewhere, a senior is eating foods they think are healthy, foods their doctor recommended, but those foods are doing nothing for their blood pressure. And simultaneously, somewhere else, another senior is eating the 8 foods I'm about to reveal, and their blood pressure is dropping 15, 20, even 25 points without medication. I've been a cardiologist for 23 years, and I've seen both scenarios transform lives. But here's what almost no one talks about. It's not about eating healthy in general. It's about eating specific foods that target specific mechanisms in your cardiovascular system. Foods that dilate your blood vessels, foods that reduce arterial stiffness, foods that eliminate excess sodium, foods that calm your nervous system. By the end of this video, you'll know exactly what those 8 foods are. But more importantly, you'll understand why food number 1 is so powerful that it can lower your systolic blood pressure by 10 to 12 points in just 2 weeks, enough to avoid starting medication or reduce what you're already taking. But I'm getting ahead of myself. Before I can show you food number 1, you need to understand something about blood pressure and food that changes everything. Something that your doctor probably never explained. Stay with me because what happens in the next 8 minutes will transform how you think about every meal you eat. Let me tell you about Robert first because his story is going to reveal food number 8, and it's going to surprise you how something so simple can create such dramatic results. Robert was 71, a retired accountant who'd been on blood pressure medication for 6 years. 2 medications, morning and night. His readings were acceptable, but not great. 138/86. His doctor kept saying they were close to goal, but Robert felt tired all the time. He wondered if the medications were making him sluggish. Then Robert's daughter, a nutritionist, came to visit. She looked at his diet and was horrified. Robert was eating the standard American diet. Processed foods, high sodium, very few vegetables. She made him one simple change. She told him to eat 1 cup of cooked spinach every single day. Just spinach. Nothing else changed. Robert thought it was ridiculous. How could spinach lower blood pressure? But he trusted his daughter, so he did it. 1 cup of cooked spinach with dinner every night. After 2 weeks, Robert checked his blood pressure. 128/78. 10 points lower. He couldn't believe it. He kept eating the spinach. After 4 weeks, his reading was 124/76. His doctor was shocked. "What changed?" he asked. "Just spinach," Robert said. The doctor was skeptical, but the numbers didn't lie. Here's what Robert didn't know, and here's what makes food number 8 so powerful. Spinach is loaded with something called nitrates. Not the synthetic nitrates in processed meat that are harmful. Natural nitrates that your body converts into nitric oxide. And nitric oxide is the most important molecule for blood vessel health. It dilates your arteries. It makes them relax and widen. When your arteries widen, blood flows easier. Your heart doesn't have to pump as hard. Pressure drops. But here's where it gets better, and this is the part that leads us toward the really powerful foods. The nitrates in spinach aren't just temporary. They create lasting changes in your vascular function. Your blood vessels become more responsive, more flexible. Robert's blood pressure stayed low because his cardiovascular system was actually healing. Food number 8 is leafy greens, specifically spinach, kale, arugula, and Swiss chard. The rule is simple but absolutely non-negotiable. You need at least 1 cup of cooked leafy greens or 2 cups of raw leafy greens every single day. This provides the nitrates your blood vessels need to produce nitric oxide. Without this, your arteries stay constricted, stiff, your blood pressure stays high. But here's what I need you to understand before we move to food number 7. And this is crucial. Food number 8 was easy. Robert just added spinach. But food number 7 is one that people avoid because they've been told it's too high in fat, and it drops blood pressure by 8 to 10 points consistently. I'm going to tell you what food number 7 is in a moment. But first, I need to show you something that's going to change how you think about fat and blood pressure forever. There's a reason Mediterranean populations have the lowest rates of hypertension in the world. There's a reason their arteries stay flexible into old age. It's not genetics. It's not luck. It's fat. The right fat. That's food number 7. Let me tell you about Maria, because Maria's story is going to reveal something that almost no one knows about blood pressure and healthy fats. Maria was 68, originally from Greece but living in America for 40 years. She'd adopted the American diet, low-fat everything. Her blood pressure crept up over the years, 145/90. Her doctor put her on medication. It helped, but Maria hated taking pills. Then Maria's sister came to visit from Greece. She was 72, ate traditional Greek food, and wasn't on any blood pressure medication. Her pressure was 118/75. How is that possible? Maria asked. My sister eats olive oil with every meal. She eats cheese. She eats fatty fish. I eat low-fat everything, and I'm on medication. Maria's sister explained that the problem wasn't fat. It was the type of fat and the lack of it. She convinced Maria to go back to eating like they did in Greece. Lots of extra virgin olive oil. Real olive oil, the dark green kind that tastes peppery and burns your throat slightly. Maria started using 3 tablespoons a day, on salads, on vegetables, even a spoonful in the morning, on an empty stomach like her grandmother used to do. After 3 weeks, Maria's blood pressure dropped to 132/82. After 6 weeks, 126/78. Her doctor couldn't believe it. He reduced her medication dose. Maria kept eating the olive oil. 3 months later, she was off medication completely. Blood pressure stable at 124/76. Here's why this works. And this is important because it reveals something most doctors don't understand about blood pressure. Extra virgin olive oil contains polyphenols, powerful compounds that do 3 things simultaneously. First, they reduce inflammation in your blood vessels. Inflammation makes arteries stiff and narrow. Polyphenols calm that inflammation. Second, they improve endothelial function. The endothelium is the thin layer of cells lining your arteries. When it's healthy, it produces nitric oxide. When it's damaged, it can't. Polyphenols repair endothelial damage. Third, they reduce oxidative stress. Free radicals damage your cardiovascular system. Polyphenols neutralize them. The result is arteries that are more flexible, more responsive, healthier. And flexible, healthy arteries mean lower blood pressure. Food number 7 is extra virgin olive oil. Not refined olive oil, not vegetable oil. Extra virgin. The darker and more peppery the taste, the more polyphenols it contains. You need 2 to 3 tablespoons daily. Use it on salads, vegetables, even take a spoonful straight if you can tolerate it. But here's what Maria's story teaches us. And this is critical for understanding the foods that are coming. Blood pressure isn't just about sodium and medication. It's about giving your cardiovascular system the nutrients it needs to function properly. Every food we're going to discuss provides something your blood vessels are desperately lacking. And food number 1, the one I'm saving for the end, provides the most critical nutrient of all. Before we get there, I need to show you food number 6 because this one is going to seem too good to be true until you see the research. And once you see the research, you'll realize why this single food can drop your blood pressure by 6 to 8 points in just 4 weeks. Food number 6 is going to shock you because most people think it's unhealthy. Let me tell you about Helen, 73 years old, who discovered this food by accident. Helen had high blood pressure for 10 years. She was on medication, but her readings were still borderline high, 136/84. Then, Helen's grandson moved in with her temporarily. He was a college student, and he loved making smoothies. Every morning, a big berry smoothie, blueberries, strawberries, raspberries. He'd make enough for 2 and give Helen a glass. Helen drank it to be polite. She didn't think much of it, but after a month, she noticed something strange. She was feeling better, more energetic, and when she checked her blood pressure, it was 124/76, 12 points lower on the systolic. She kept drinking the smoothies. Her pressure stayed low. When her grandson moved out, Helen kept making the smoothies herself. Her blood pressure remained stable at 122/74. Here's what was happening. Berries, especially blueberries and strawberries, are loaded with compounds called anthocyanins. These are the pigments that make berries blue and red. But they do something remarkable in your cardiovascular system. They increase nitric oxide production even more than leafy greens. They reduce arterial stiffness, making your blood vessels more elastic. They lower inflammation throughout your entire vascular system. And they improve the function of the cells lining your arteries. Multiple studies have shown that eating berries daily can lower blood pressure by 6 to 8 points. One study specifically found that 1 cup of blueberries daily for 8 weeks reduced blood pressure in people with metabolic syndrome. The effect was comparable to blood pressure medication. Food number 6 is berries, specifically blueberries, strawberries, raspberries, and blackberries. You need at least 1 cup daily. Fresh or frozen doesn't matter. Frozen berries actually retain their anthocyanins very well. Add them to smoothies, yogurt, oatmeal, or eat them plain. But here's where this connects to something bigger, something that's going to become critical when I reveal food number 1. Every food we're discussing works through a specific mechanism. Spinach provides nitrates. Olive oil provides polyphenols. Berries provide anthocyanins. These aren't random nutrients. They're targeted compounds that fix specific problems in your cardiovascular system. And the foods that are coming, especially number 1, provide the nutrients your blood vessels need most desperately. Let me show you food number 5, because this is where most people start to realize they've been eating all the wrong things. Food number 5 is something most Americans don't eat enough of. Let me tell you about James, 69 years old, who came to my office frustrated. His blood pressure was 142/88 despite medication. He was eating what he thought was a healthy diet. Lean chicken, some vegetables, not much else. I asked him about potassium. He looked confused. Bananas, he said. I eat a banana sometimes. That's not enough, I told him. Most Americans get maybe 2,500 milligrams of potassium daily. You need 3,500 to 4,700. James had no idea. I gave him a list of high-potassium foods: potatoes, sweet potatoes, white beans, lentils, avocados, bananas, oranges, tomatoes, spinach. I told him to eat at least 2 high-potassium foods with every meal. James started eating a baked potato with lunch, sweet potato with dinner, avocado on his morning toast, white beans in soups. After 3 weeks, his blood pressure dropped to 132/82. After 6 weeks, 128/78. His doctor was able to reduce his medication dose. Here's why potassium is so critical, and this is something most doctors don't explain well enough. Your body maintains a delicate balance between sodium and potassium. Sodium pulls water into your blood vessels, increasing blood volume and pressure. Potassium helps your kidneys excrete excess sodium. It also helps your blood vessel walls relax. When you don't get enough potassium, sodium dominates. Your blood volume stays high. Your vessels stay constricted. Pressure stays elevated. But when you increase potassium intake, especially from whole foods, everything shifts. Your kidneys dump excess sodium. Your blood volume normalizes. Your vessels relax. Pressure drops. Studies show that increasing potassium intake can lower blood pressure by 5 to 8 points, especially in people who eat a lot of sodium. Food number 5 is potassium-rich foods. Specifically potatoes with skin, sweet potatoes, white beans, lentils, avocados, bananas, oranges, tomatoes, and dark leafy greens. You need at least 3,500 milligrams daily from food. That's roughly 2 to 3 servings of high-potassium foods with each meal. But here's what James's story teaches us about the bigger problem. And this is crucial for understanding why food number 1 is so important. Most people focus on reducing sodium. That's good. But increasing potassium is equally important, maybe more important. Your body needs the right balance, and food number 1 provides something even more fundamental than potassium. Before I show you mistake number 4, I need to ask you something. If what you're learning right now is valuable, if you're realizing you've been missing these foods in your diet, I need you to do 2 things. First, subscribe to this channel. My mission is to give you information that can actually reverse disease, not just manage it. I'm giving it to you free because I believe seniors deserve access to truth. Second, share this video. Think about your family, your friends, anyone struggling with high blood pressure. This information could help them reduce medication or avoid starting it in the first place. Now, let me show you food number 4. And this one is going to surprise you because it's something many people avoid thinking it will raise their blood pressure. Let me tell you about Patricia, 70 years old, who had been avoiding this food for years. Patricia had high blood pressure and her doctor told her to reduce sodium. Good advice. But Patricia thought that meant avoiding all fish, especially canned fish, because isn't canned food high in sodium? She stopped eating tuna, salmon, sardines, all of it. Her blood pressure stayed stubbornly high at 144/86 despite medication. Then Patricia read an article about omega-3 fatty acids and blood pressure. She was skeptical, but she started eating canned salmon twice a week. She made sure to buy low-sodium versions. After a month, her blood pressure was 134/80. She increased it to 3 times a week. After 2 months, 128/76. Her doctor was impressed. "What changed?" he asked. "I started eating salmon again," Patricia said. Here's what makes fatty fish so powerful. They contain omega-3 fatty acids, specifically EPA and DHA. These fats do something remarkable in your cardiovascular system. They make your blood vessels more flexible and responsive. They reduce inflammation throughout your vascular system. They thin your blood slightly, making it flow easier. They can even reduce heart rate slightly, which lowers the workload on your heart. Multiple large studies have shown that eating fatty fish 2 to 3 times per week can lower blood pressure by 4 to 6 points. That might not sound like much, but combined with the other foods we're discussing, it adds up. Food number 4 is fatty fish, specifically salmon, mackerel, sardines, herring, and trout. Fresh or canned doesn't matter as long as you choose low-sodium canned versions. You need 2 to 3 servings per week, each serving about 3 to 4 ounces. But here's what Patricia's story reveals about the nature of these foods. And this is important for understanding what's coming. Most people think lowering blood pressure is about restriction. Don't eat this, don't eat that. But it's actually about addition. Adding the right foods that provide what your cardiovascular system needs. And food number 3, the one I'm about to reveal, is critical because most seniors are severely deficient in it. Food number 3 is going to seem boring until you understand the mechanism. Let me tell you about Walter, 74 years old, who thought this food was just filler, nothing special. Walter had blood pressure that wouldn't budge below 140/88 despite 2 medications. His diet was decent, some vegetables, some fruit, but very few whole grains. Mostly white bread, white rice, white pasta. His daughter, a nurse, suggested he switch to whole grains. Oatmeal for breakfast, brown rice instead of white, whole wheat bread instead of white. Walter thought it wouldn't matter, but he tried it anyway. After 4 weeks, his blood pressure dropped to 132/82. After 8 weeks, 126/78. His doctor reduced one of his medications. Here's why whole grains work. They contain fiber, but not just any fiber. Soluble fiber that does 3 critical things. First, it helps your body excrete cholesterol. Lower cholesterol means less arterial plaque, which means more flexible arteries. Second, it feeds the healthy bacteria in your gut. Those bacteria produce compounds that lower inflammation throughout your body, including your blood vessels. Third, it slows the absorption of sugar into your bloodstream. More stable blood sugar means less stress on your cardiovascular system. Studies have shown that people who eat 3 or more servings of whole grains daily have blood pressure that's 3 to 6 points lower than people who eat mostly refined grains. Food number 3 is whole grains, specifically oatmeal, brown rice, quinoa, whole wheat bread, barley, and whole grain pasta. You need at least 3 servings daily. But here's what Walter's story connects to, and this is important for understanding food number 1. Every food we've discussed so far provides nutrients that work together. Nitrates from greens, polyphenols from olive oil, anthocyanins from berries, potassium from vegetables, omega-3s from fish, fiber from whole grains. They're not competing, they're synergistic. And food number 2 and food number 1 provide the final pieces that make everything else work better. Let me show you food number 2, because this is where people start to realize that blood pressure control isn't about one magic food, it's about a pattern of eating. Food number 2 is something that sounds too simple to be effective. Let me tell you about Dorothy, 68, who dismissed this food as peasant food, nothing that could help her serious blood pressure problem. Dorothy was on 3 medications. Her pressure was barely controlled at 138/86. She felt terrible, weak, dizzy sometimes. Her daughter suggested she eat more beans and lentils. Dorothy thought it was ridiculous. Beans and lentils for high blood pressure? But her daughter was persistent, so Dorothy added a half cup of beans to her lunch salad every day. After 2 weeks, nothing changed. But Dorothy kept eating them. After 4 weeks, her blood pressure was 132/80. After 8 weeks, 126/76. Her doctor reduced her medication. Dorothy was shocked. Here's what makes beans and lentils so powerful. They contain a perfect combination of 3 things your cardiovascular system needs: potassium, as we discussed earlier, magnesium, which helps blood vessels relax, and fiber, which lowers cholesterol and inflammation. But they also contain something else: plant proteins that have been shown to lower blood pressure more effectively than animal proteins. And they're virtually sodium-free, which means they help shift your sodium-potassium balance in the right direction. Studies have shown that people who eat beans or lentils 4 or more times per week have blood pressure that's 3 to 7 points lower than people who rarely eat them. Food number 2 is beans and lentils. All types: black beans, kidney beans, chickpeas, lentils, pinto beans. You need at least a half cup daily, preferably more. But here's the critical point. This protocol only works if you're eating all these foods together. If you eat spinach but skip the olive oil, you're missing the polyphenols. If you eat berries but skip the beans, you're missing the magnesium. These foods work together as a system. And food number 1, the one that almost everyone is deficient in, is the foundation that makes everything else work. And now we've arrived. Food number 1, the most powerful, most effective, most research-backed food for lowering blood pressure naturally. The food that can drop your blood pressure by 10 to 12 points in just 2 weeks. The food that works as well as some medications. The food that thousands of seniors have used to reduce or eliminate blood pressure drugs. Are you ready? Here it is. Food number 1 is beets, specifically beetroot, either raw, cooked, or as juice. I know what you're thinking. Beets? That's the big revelation? Yes. And let me tell you why this is so powerful that I saved it for last. Let me tell you about George, 72, meticulous, skeptical, a retired chemist who didn't believe in food as medicine. George was on 3 blood pressure medications. His pressure was 136/84, barely acceptable. He felt exhausted all the time. His daughter read about beetroot juice and blood pressure. She bought him a juicer and fresh beets. George thought it was nonsense, but he agreed to try it for 2 weeks. 1 cup of fresh beetroot juice every morning. After 1 week, his blood pressure was 128/78, 8 points lower. After 2 weeks, 122/74, 14 points lower. George couldn't believe it. He kept drinking the juice. His doctor reduced his medication. After 3 months, George was on just 1 blood pressure medication instead of 3. His pressure remained stable at 124/76. Here's why beets are so extraordinarily powerful. They contain more dietary nitrates than any other food. We talked about nitrates in spinach, but beets have 3 to 4 times more. When you eat beets, your body converts those nitrates to nitric oxide within hours. Nitric oxide dilates your blood vessels immediately and dramatically. Blood flows easier, pressure drops. But here's what makes beets even more powerful. The effect lasts. Regular beet consumption creates lasting improvements in endothelial function. Your blood vessels stay more flexible, more responsive. Multiple clinical trials have shown that drinking beetroot juice or eating cooked beets daily can lower systolic blood pressure by 8 to 12 points. That's as much as some blood pressure medications. Food number 1 is beets. You can eat them roasted, boiled, raw in salads, or as juice. The most effective form is juice because it provides concentrated nitrates. You need about 1 cup of juice or 1 to 2 medium beets daily. The rule is absolute and non-negotiable. If you're serious about lowering your blood pressure naturally, you must include beets in your daily diet. Nothing else provides nitrates at this concentration. This single food can be the difference between needing medication and not needing it, between taking 3 pills and taking 1. Now you know all 8 foods. You understand why each one matters. You understand how they work together synergistically. And you understand why food number 1 is so powerful that everything else builds on it. Let me give you the complete protocol, the gold standard. Follow this exactly and your blood pressure will drop, often dramatically. First, every single day, eat or drink beets. 1 cup of juice or 1 to 2 medium beets. This is non-negotiable. Second, eat at least 1 cup of leafy greens daily. Spinach, kale, arugula, or Swiss chard. Third, use 2 to 3 tablespoons of extra virgin olive oil daily, on salads, vegetables, or straight. Fourth, eat 1 cup of berries daily, fresh or frozen. Fifth, eat at least 2 servings of high-potassium foods with each meal: potatoes, sweet potatoes, beans, avocados, bananas. Sixth, eat fatty fish 2 to 3 times per week: salmon, mackerel, sardines. Seventh, eat 3 servings of whole grains daily: oatmeal, brown rice, whole wheat bread. Eighth, eat beans or lentils daily, at least a half cup. Follow this protocol and you're not just lowering blood pressure. You're healing your cardiovascular system. You're providing everything your blood vessels need to function optimally. Your blood pressure will drop. Your arteries will become more flexible. Your risk of heart attack and stroke will plummet. Before we finish, let me tell you about Margaret, 75, because her story brings everything together. Margaret was on 4 blood pressure medications. She felt terrible, weak, dizzy, no energy. Her pressure was barely controlled at 142/88. She came to me asking if there was anything else she could do. I gave her this exact protocol, all 8 foods, every day. Margaret was skeptical but desperate. She followed it exactly. After 2 weeks, her blood pressure was 132/80. After 4 weeks, 126/76. Her doctor reduced her medications. After 3 months, Margaret was on just 1 medication. Her pressure was 122/74. Her energy returned, dizziness disappeared. Now you have the complete protocol. You know the 8 foods. You know why they work. You have the tools to take control. Use them. Share this video with anyone struggling with high blood pressure. Subscribe to this channel for more information that gives you real solutions, not just pharmaceutical band-aids. Your health deserves real food. Your body deserves proper nutrition. And you deserve the freedom that comes from lowering your blood pressure naturally. Take care of yourself, and I'll see you in the next video.